I want to thank you for joining us at the 11 Alert Desk today. I am Aspen Andrews, digital content producer at 11 News, and I am here with Steve Carleton, Chief Clinical Officer at Porch Health. And with February being Heart Health Month, it's a great time to discuss heart health as well as the effects that alcohol and drugs can have on the heart. So I'm going to go ahead and start. So could you tell me a little bit, Steve, how does alcohol affect your heart?
Yeah, hi Aspen. It's good to be with you. It's interesting. So, alcohol impacts the heart in a couple different ways, depending on whether it's alcohol or illicit substances. With alcohol in particular, what's kind of counterintuitive about it is alcohol increases people's heart rate, right? And we think about alcohol as a sedative and something we do to relax, but physiologically, it increases your heart rate. And over time, with chronic use especially, it can start to weaken that heart muscle and cause damage.
And on the other end, how can substances and drugs affect your heart?
Yeah, great question. So with substances, if you're talking about stimulants, obviously we know stimulants speed people up, and you have the same kind of effect, but probably more pronounced than with alcohol. With stimulants, they really are hard on that heart muscle. Your heart is pounding if people are using cocaine or methamphetamine, and so cardiac arrest and heart attack and things like that are very much a risk. With opiates slow your heart rate, right? So opiates are a respiratory depressant. So if you're taking opiates and other types of sedatives, that can slow your heart rate and people can stop breathing. And on the other end, with things like opioids and fentanyl, if people are IV users, IV drug use can cause infections in the heart and lead to disastrous consequences.
And when it comes to both alcohol and substances, why exactly can they affect your heart?
Well, because your heart's a muscle, right? At the end of the day, and anything you put in your body is going to have an effect, right? And so you should think about substances, alcohol, and other illicit substances the same way you would chocolate cake, right? We know that like chocolate cake is delicious. It's fun to eat. It's great to do when you're celebrating somebody's birthday, but to eat chocolate cake every day, all day, every day would not be a good idea. And so when you're thinking about substances, using that same type of metric, right? If you're having one or two, knowing that's not something that's going to be good for you, right? We used to think that alcohol was good for cholesterol and good for heart health. And recently, what we found from research, decades of research, is that there's no safe amount of alcohol, right? There's no amount of alcohol that has any healthy benefits to you, right? And so think about it like chocolate cake. And, how often would you do that?
Exactly. And I know, of course, there are some people who might be struggling or having issues with this. So could you give us some advice for anyone who might be struggling or just want to strengthen their heart health as a whole?
Yeah, absolutely. I think people don't often think about just what does reducing consumption look like and what do like a healthy breaks look like? What are your limits for alcohol consumption? Oftentimes people just kind of drift in and out of drinking, especially, and they don't sit down and say what is acceptable to me, right, in my lifestyle and what's not acceptable, and noticing sort of when you're exceeding those limits and sort of bringing it back to a baseline. So I think that's a really good idea. And if you're worried about it, seeking professional help, right? Like go talk to a counselor, go talk to a therapist, like talk to somebody objective that can give you advice where you can be open and honest without fear of judgment.
That makes sense. And I know we talked a little bit about for yourself who might need some help, but what about if a loved one has issues with maybe drinking or taking substances or just struggles with mental health as a whole, how do you think you can bring it up to that loved one?
Yeah, absolutely. So when you think about approaching somebody that you're worried about, set and setting are the most important thing. So if you're deciding to have a conversation with a loved one about their use, that you're worried that it's getting more intense, don't have that conversation when they're under the influence. That's not a good time to do that. Pick a time that's going to be calm and relaxing, right? Lead with compassion, not judgment, right? Like so using those old therapist I statements, right? I am concerned about you. Here's what I have observed is different about you lately. And I would like to help you with this, right? Like leading with that so it's not coming cross judgmental. And people are naturally going to be defensive in those conversations. And if you can just roll with that, if you can not react to it when people are getting defensive, let them absorb it. I think those are some quick tips on how to facilitate those kinds of conversations. And then lastly, just not repeating yourself, not having it be sort of a topic for conversation every time you see that person, right? People need time to absorb.
Yes, that's very helpful. Thank you. And is there anything else that you would like to tell us about Porchlight Health and Heart Health Month as a whole?
Yeah, for Heart Health Month, I think people out there can know we have a drinking less program, right? There where people can come in and do 4 brief therapy sessions. You don't have to go through a long paperwork process. You don't have to go through a long history process. You can come in and you can dive in with a therapist and talk about your relationship with alcohol. Concurrently, you can see one of our medical providers. There are medications that help people with cravings and that are proven to help reduce the amount of alcohol you're drinking, right? And so I think Porchlight is a great option for people looking to do that.
Thank you. And also for those who might want to learn more, how can we find you?
So online, porchlighthealth.com, or our 1-800 number is 866 MATSTAT, MATSTAT, 866 MATSTAT.
Great. Thank you so much, Steve. I appreciate you for taking the time to talk to me this afternoon and give our viewers a little bit of insight as it is Heart Health Month. Thank you so much.
My pleasure. Thank you, Aspen.